Hey everybody, we're here with Dr. Annie Gutierrez, one of our therapists with Green Line Psychological Services. Hi, Dr. Gutierrez. Thanks for being with
Hey,
us today.
thank
Um,
you.
so everybody, we're just here to get to know Dr. Gutierrez a little bit, or actually, you prefer to go by Dr. Annie, so we'll
Yeah,
we'll go with that today. So yeah, maybe just tell us a little about yourself, and we'll just get started with that.
sure. So I am a psychologist, like you mentioned. I'm licensed in California and Arizona. I did some work in Arizona, and now I'm back in California, which is very exciting. This is my home state. I have two cats, one of whom is going to be present during this introduction video. This is Rosie
Hello,
Cotton.
Rosie.
Um, I like to read. I like working with people. I have two kids who take up all of my time and energy when I'm not in therapist mode. Um, and yeah, I'm excited.
Yeah. Um, and you mentioned you've worked in Arizona. I know you do some teaching as well. So you wear a lot of
Yep.
different hats, as all moms do.
Yeah.
I know you like to do some of your work with moms. Maybe we'll talk about that in a little bit as well. Yeah, I think for our time here together, one of the things I really want people to get to know is just kind of what it is that drives you as a psychologist. What is it that you like about this field? Kind of what can people expect when they sit down to talk with you about their life? Kind of what is it like to work with you?
Yeah. Well, as far as what I like about the field, I think that it's really rewarding to be a psychologist and to work in the mental health field, because you get to come alongside people and be part of their journey and part of their story. I appreciate those days, weeks, months of being able to work with someone on whatever their process is, what healing looks like for them, what they're bringing into the room, and just being able to be part of that is a joy, I think. And then I also, like you mentioned, really like working with moms, and that's kind of where my passion is. It's hard to be a mom, and having a support system that is outside of just friends and family, I think is important for us as well as moms to be able to have that extra, maybe like third party or outside view that's kind of helping to support in the mess that is motherhood. And it's just a lot of fun. I fought off psychology for a long time as like a teenager and early adult, but found that it was really my passion and what I was good at. And so I went for it and went all the way.
All the way, yeah, getting a
All the
doctorate.
way.
There's not much beyond that, yeah.
No.
Is there maybe a case that stands out in your mind, without telling us anything revealing about the person, but just a case that jumps out as like this kind of speaks to why I do what I do, or somebody that really stands out as kind of representative of why you love this work.
Yeah, I have someone who always comes to mind when I'm asked this question, and I worked with them a few years ago, and they had experienced a tremendous amount of loss as like in their younger years, and they also experienced a lot of fear of future loss, which made sense given what they had already experienced. And so I was able to work with them to just kind of talk about like what grief looks like and how sometimes in society we're told to sort of like move on and get past it and move over it, but being able to really honor what that pain and what that grief was for them and then also find whatever new normal meant for them. That was really rewarding for me. I felt a lot of connection to them as a client, as I do, I think, with most, like a, respectful amount. Oh, Rosie Cotton. Of connection, but they pop up in my mind a lot, even just throughout the years as I see or hear something that reminds me of them.
Yeah, yeah. There's definitely. I think we all have some of those people that kind of come to mind as those iconic folks that we've worked with that really stand out as having done some really good work.
Yeah.
Um, Actually, that's something I wanted to make sure to ask you about is, if somebody's watching this and they're thinking, would I want to work with Dr. Annie, right? Would we be a good fit to do some of this important work together? And it is work, right? It can be a challenge, and you mentioned it's support. It's a lot to come share your story with somebody.
Mhm.
It's a vulnerable thing, right? But I think it can be really rewarding for both folks. So, um, how would somebody know that there's a good chance you're going to be a fit for them? Like, who's an ideal client to work with you? Like, what would they be looking for in themselves to know, I think I'd be a good fit to work with Dr. Annie?
Yeah, I really enjoy, and I think most of us do, someone who is coming to therapy for themselves and not for another person. Um, we can have people in our lives who might say, I think you might need more support, or have you tried talking to a therapist about that? And that can be beneficial to have those outside voices kind of helping move us on. But when we're not ready for therapy, or when we don't see whatever it is that our friends or family might see, it can be more difficult, I think, for the client, the person coming in, to do that work. Um, it might also be a little bit extra work on our end as a therapist to kind of help figure out or help them figure out what it is that they're wanting or needing from us. But I definitely enjoy working with someone who comes in wanting that growth and that healing. And it doesn't mean that they have to know what that looks like. That's part of our journey to work together on how to get to wherever they want to go, or how to figure out what it is that they want to do and where they want to go. But definitely someone who is um, open to the experience of therapy, to the techniques that we can bring, and also someone who's open to be able to tell me when they don't think that I'm doing the best job in what I'm doing. I want to know if the direction that we're going doesn't necessarily work, or if there's something that they think could be different or better, because that's part of what therapy is. It's not me sitting in a room telling someone what to do. Um, I feel like clients know themselves better than we know them most of the
Wait, wait,
time.
wait. You don't always have all the answers to
I
life's
don't.
problems?
I
I,
don't.
I always have all the, no.
I might tell my kids that I always have all the answers and that
Yeah,
mom is just
shh.
like screaming. I know, I hope they're not listening at the door.
Yeah, right.
But no,
I
I
wish
don't always have
our
them.
job would be a lot easier if we had all the answers all the time,
It
right?
would be. Yeah, I'd be a
Yeah,
better wife, a better mother, a better.
yeah. That would
But
be nice. Yeah. I make sure to bring my crystal ball to all therapy sessions. Yeah.
yes. But also, I mean, don't be like scared of crying in our sessions, emotions, getting mad. I could take all that. That's okay.
Yeah. Yeah. I always say, if you can't say it in therapy, where can you say it? Right. And if you can't say whatever it is to your therapist or about your therapist, who can you say it to?
Mhm.
So I think that's one of the superpowers of therapists is if you need to say something, if you got some feedback, we can probably take it.
Right.
So yeah. So I guess what I'm hearing from you is that you can be helpful, you've got a plan, but if that plan needs to pivot, that you're open to that. You want to hear the feedback. You've got some ideas and you want to be helpful and you think you can be, but you're open to feedback and that you want it to be a collaborative process.
Yes.
You want to work together. You don't just want to tell people what to do.
Yeah, I want the environment to feel warm and open. And that's not to say that therapy is always happy and joyful. It's hard work, but I still want it to be a space where you're doing hard work and you generally feel better at the end of the session.
Mm, yeah. Sounds like you enjoy your work with your clients.
I do.
Yeah. What is it that keeps you going? Because I mean, you do some heavy work. I know some of your work has involved things like postpartum depression. You talked about grief work. I mean, that's some heavy stuff. So, what is it that keeps you going and working in people's darkest times?
The biggest thing is having as much of a work-life balance as I can. I think balance is sometimes a silly word when we talk about it, because it's not like necessarily even, but being able to kind of close the computer, walk out the door, and as much as I can, like leave those things in that room, and be able to put myself fully present into my family. And that really replenishes a lot of my energy. I am a Christian, so I rely on my faith a lot. But also being able to see the growth in clients and being able to be part of that journey is rewarding as well because it is hard, but there are so many people that I have seen them get to the space that they want to be, or at least I've gotten them closer before I've had to leave in times where I only had a limited amount of time at a certain place. But um, I think being able to just kind of relax and be with my family, do some of my extra curricular activities, and then just focus on the positive aspects of it as much as I can, even though it is really heavy. But if we don't hold that space, then a lot of times people don't feel like anyone's holding that space for them.
Yeah. There's definitely a need to practice what we preach, right?
Yeah, it's hard.
Yeah. And and you mentioned your own personal faith. How much does faith or religion, spirituality make it into the sessions with your clients? I know that you don't see it as your job to bring your own uh, religion into the space, but if your clients want that to be part of their work, is that something you make room for? Is that allowed? Is that something you make room for, or is that kind
Yeah.
of up to them?
No, absolutely. I faith, culture, anything that is important to someone, I want them to be able to bring into the room. So if that happens to be that we share the same faith, then I certainly have that, I guess, added background of already kind of knowing what I'm talking about. But if it's a different faith, I will either invite the client to share some information with me about it, or I'll do my own research into it and kind of bring that in of maybe this could be helpful in whatever it is that we're working with. And I've had a number of clients over the years that don't want faith at all, and that's perfectly okay as well. And so it's about their culture and what's important to them, and how can we use that in therapy to help you kind of move forward with your goals.
Okay, good. Well, I want to wrap it up here, and people are always welcome to give you a call and check in and talk a little more about the specific challenge that they're working on in their life, and kind of get your initial consult on their situation. But any kind of last words, parting thoughts for anybody that's watching this and maybe is kind of on the fence about whether to give you a call here?
I definitely invite you to give me a call. Those first impressions can be certainly helpful, like watching this video, being able to get to know me a little bit, but being able to call and have some consultation and let's talk about what it is that you're going through. And if I'm not the best fit for you, we have other amazing providers at Greenline that we can talk with as well and see, where the best spot is for you. But I want to be able to be part of people's journeys. That's why I'm in this field. And so I would love, especially anyone like a mom who is just needing some extra support, wanting to have someone extra on their team. I invite you, someone who's experiencing anxiety, depression, like let's talk and let's see what's going on. I'm available.
Yeah. Very good. All right. Well, thanks, Dr. Annie. Good chatting with you today. And like she said, give her a call. Her information's on the website. We look forward to hearing from you soon.
Thanks.